4, 3. Welcome, everybody. Today, I have a very special guest and a very special friend, colleague, and master of upper cervical techniques, Dr. Jeffrey Hanna, whom I've known for a long time, both Palmer graduates. I was educated by his father, David Hanna, at Palmer College. David now resides in Australia, and so does Jeff. And I just want to ask Jeff what he's been up to lately with his upper cervical technique. Jeff originally defected from Atlas orthogonal and Palmer upper cervical, and now is a Blair master. And I would like to welcome Jeffrey Hanna.
Well, thank you for the introduction, Joe, but I got to correct you. It's a long way away from master. I continue to find plenty of things that I need to continuously improve on. So we got a long ways to go before that. Hopefully a little better than I would have been a few years ago, even a few months, but long way to go before we'll be calling ourselves or even considering master.
Can you put your pisiform or your finger on one thing that you would say is a difficult thing to master in Blair, or perhaps any other technique?
All of it. I would make the case as the predecessors before me, I believe it was Blair himself who said it, is that this is a technique that you will never master. There are always nuances, ways that we can be finding room for improvement, or if you would, even as BJ said it, improving our percents. Until the day where, any one of us is hitting 100% success on that first adjustment every single time, there's going to be something to learn. And so I don't know about yourself, but I can only speak on my behalf. It's like, okay, I'm a long ways away from there. And so I would certainly hope that that percent will keep going up. But whether it is in terms of the analysis, the timing, the adjustment itself, or the great many other variables that it can impact the person in that moment, until we have full command over all of those variables, minimizing them, controlling them as much as possible, we all got a long ways to go.
Well, the Blair adjustment is very exuberant. How important, though, is the patient setup?
Define exuberant.
It's skilled. It's
okay.
That's part of the mastery. See, I adjust with an instrument, which goes, and you have to deliver it with the, I wouldn't say imperfect hand, but the variability of the manual art. So what's more important, the setup? I know you're going to say both, but how important is the setup of the patient? Because that seems to be one thing that upper cervical techniques meticulously pay attention to over a lot of other techniques.
In all honesty, I don't think that we emphasize that as much in the Blair system as we probably should, in part because it's not formal. Blair procedure is just done with the patient lying neutral. So you don't want their head too far forward, shoulders are neutral, back is neutral. So yeah, you're making sure relative alignment. But there is, in all honesty, not the nth degree when it comes to headpiece placement. We're getting there eventually. Too many consonants there. But in brief, I still believe it is quite very important. I have tried a number of combinations over the course of the years because of my orthogonal background. Should I set this person with a higher headpiece? Should I set with a low headpiece? Should I use a sharp contact? Should I use a high contact? Should I use an inverted contact a la a knee chest kind of setup? Should I be doing anything with their shoulder as a way of maximizing tension so that that adjustment can be just that lightest little thing, so that you set up, it needs everything ready to go and then right there. So yes, I absolutely believe that the proper patient positioning and also the headpiece placement, they make the work of the doctor a lot easier, whether that is using your adjusting machine or me, the adjusting machine. One way or another. I am the adjusting machine.
You are indeed an adjusting machine. What is your favorite part about the delivery of your seminars? What's the part you love to deliver? And don't say all of it.
No, the cruelty. The cruelty.
Yes, delivering cruelty to...
Delivering cruelty. Now, for right or for wrong, and I think that you would agree with this, is that the nature of upper cervical itself is not to the generalist. It's not the person who wants the easy way route. I've heard it's the path of most resistance. It's the person who wants to know the who, what, why, when, how not, when not, and all of the inside out details. And so much like, if you were, I use the example oftentimes in the US of the Marines, they're not looking just for anybody. They're looking for the best of the best of the best. Now, what this requires then that you set the bar high. Now, for right or for wrong, I don't pull any punches when I am teaching my own courses. I come hard, I come fast, to the point where arguably, yes, I would call myself a little bit sadistic. But the part that I do enjoy in it is I enjoy not just breaking, but shattering some of the false things that chiropractors are told, whether students or experienced practitioners, things that we believe. And I can show them piece by piece, logically, how what they may have been presented may not actually be true in reality. See, so many people come into this. Why? Because they're frustrated. They feel like there's something more, but there's a disconnect between what they are currently doing, what they've been told, and where they believe that they can go. And I'm not saying upper cervical, any of the techniques have all of the answers. Again, none of them do. And there's merit and value in all of the approaches, but they know intuitively that there is something missing. So having that opportunity to break through and actually show them these are the contradictions, and here is a solution.
Okay,
to show them and to walk their hand through it, that here is actually how we can put all of these bits and pieces together. And you see that light bulb go on where they get it. And in reality, even if they never practice that technique, that you have given them something extremely valuable that they will now be able to use in whatever form they are doing. And of course, if they, pursue that, even better. So that's what I like the most. It is breaking people, but then helping put the pieces back together, because I know that on the other side of it, they are so much stronger for it.
You can't break it down and not build it up. So what would be the most shattering thing you come across? Just give me one or two, a couple examples of what's the most shattering myth or whatever you want to call it.
Oh, that everybody's adjusting wrong. Okay.
And how do they respond when you tell them they're adjusting wrong? Do they run out of the room?
I don't say adjusting wrong in that sense. So what I am showing is the idea that so many common moves that we learn in chiropractic school, they all have their merit, but as can oftentimes be the case, I think this is not a chiropractic, this is a human condition, is we like the easy, we like the routine, and unfortunately we can get lazy. And we stop using our brain in that moment. And so it goes to really many of the different core ideas in chiropractic. Again, what's the difference between a manipulation and an adjustment? And you can describe this any number of different ways. But in brief, just because the joint goes crack doesn't mean that you actually got the desirable outcome or actually corrected anything. And so there's plenty of moves, for example, out there that they make the joint go crack. They feel good, they get a temporary stimulant effect, but in the same breath, they have no holding power. And so the person doesn't necessarily get the breakthrough. The chiropractor is frustrated because they're not seeing the breakthrough. So what is this? And so when we then take a step back and let's consider simply put the biomechanics and the premises behind why are you doing that move in the first place, is oftentimes the nature of the setup is not actually doing what we think it does. So yes, it is stretching, it is cavitating, but it actually isn't making the correction. So let's break it down into its bits and pieces. Let's think about this methodically, because if we as chiropractors truly are mechanical and neurological experts of the spine, we really need to know these basic fundamentals. So looking at the different nature of different procedures and things like that, and then saying, okay, well, in reality, no matter how you would need to make this adjustment, it has to have these components associated with it. It needs this vector with this line of drive. You do or do not use torque in this particular way. Now, whether you would choose to do that with an instrument, with your hand in side posture, lying supine, sitting in a chair, lying prone, using a Thompson drop, using an activator instrument, any way that you would want to do, just simply make sure that it is mechanically congruent with what you are aiming to achieve. And then pre and post check it. Otherwise, again, just because it made noise doesn't mean that you actually made any long-lasting neurophysiological change. And if, as we as chiropractors are emphasizing, it's the meeting between the mechanical and the neurological, we really should have a way of measuring these things.
And do you?
Oh, yeah.
Okay. Tell me the 3 most important outcome measures for you, or the 50 most, whatever you got. If you
50
will.
most. So I can talk on me. So everybody's going to have different, there's million billion different tests that you can do to assess the different components of efficacy of adjustment. Okay. One of them certainly is the patient doing better? Are they feeling better? No, it's not all about symptoms, but symptoms require context. And in reality, do they matter? Yeah. Otherwise, why would a person come to you? Yes, you can improve their body function, but in the end of the day, that has to add up to something. So how are ways that you quantify that as much as you can? So a few of the simple ones that I use is I will use infrared thermography. So using the Titron scanner to look for heat differentials. Well, why heat differentials? Well, heat is a very tightly regulated function of the body within 0.5 degrees Celsius, either side of the spine, in terms of local inflammation, muscle, and nerve activity. In other words, all expression of, is the brain happy with the state of the body, and is it regulating it in a coordinated manner? Yes or no? If the answer is yes, it's a straight line as if drawn by a 4-year-old. If the answer is no, you start seeing these weird readings. And much like a cardiologist should be able to read an ECG, or a brain surgeon, it's kind of useful. You can read an EEG. It's very useful, I find, when the chiropractor is actually able to read the squiggly line. And so to be able to have something that gives you, okay, heat as a reflection of neurophysiology, you make an adjustment. Does that change? Yes or no? Okay, that is one way that we can measure a change of neurophysiology. Another one that you can use is posture. And that can be either in an upright standing position. I like to use that. But you can also be done lying prone, or supine for that matter, using a leg length differential. In brief, if, at least in this case, if the head's off center, it's creating abnormal, basically muscle tonic responses throughout the body that can make the legs look crooked when in reality, they're the same. You make an adjustment and they balance out. Weird. Now, fascinating, because if you're adjusting in the upper part of the neck and you see a change in the foot, well, by default, what happened to everything else in between? Maybe that can actually have an effect. So it's a way of assessing not just, well, in the case of a thermography, what you're really reading is you're reading more of the autonomic control, but then this is a way where you're measuring more of the efferent. So the somatic efferent. So the motor function, motor tone of the entire system. And of course, I will also use my hands here. And Blair, officially, we don't do this, but I will use my segmental motion palpation. In brief, if we are saying that this condition, a subluxation of the joint, involves 3-dimensional, basically fixation locking, the thing ain't moving the way it's supposed to. When you make an adjustment, afterwards, are you feeling with your fingers, is it actually moving with greater ease, the way that you would expect it to, yes or no? And so okay, well, hey, even if this person's not feeling anything better, they're mechanically working the way that they should. Therefore, we would then presume the system has a better opportunity, a better chance then to be able to function the way that it's supposed to when the gears and all of this are actually able to operate the way that they're constructed. But in reality, a chiropractor can use anything as long as they can measure it, ideally as objective as possible, and also if they pattern it, in my opinion.
Great little summary there. Let's jump to another issue. Why do you think the uptake of upper cervical is so minuscule? Is it part of this perceived elitism or perfectionism or striving for the least or the most resistant path? Any ideas on why something that was taught at 20 years for at Palmer College exclusively is now a little bit on the rare side?
Yeah, actually for the exact opposite, it has nothing to do with elitism. It's the perception that if you're an upper cervical guy, you're a bit of a dummy. You're a dogmatist, that it's all turn the power on. That's all you guys are doing. You guys don't know how to diagnose. You don't know how to assess the rest of the spine. You must not be a very good adjuster. So in reality, quite the opposite. I might defer, and I do forget his exact words, but to the very recent Dr. Brooks on this one here, where he describes, at least as it related to, I remember him saying this about progress, but really it's the same in upper cervicals at 3 great enemies. And surely I'm going to remember 2, but not the 3rd. So prejudice, superstition, and ignorance. So ignorance being you just simply don't know. And, you know, especially you and I here in Australia, but really any number of jurisdictions over the course of the world. Yeah. You go to school and you think, okay, I'm spending all of this money so that I'm going to learn the nuts and bolts of chiropractic. And so if it's not on the menu, you're not even aware that it is on the menu.
Yes.
And oftentimes because you go in impressionable and you believe your instructors. Why? Because they're the ones enforcing your grades. We as human beings, we have the tendency to default to authority. They are the original authority, at least in these young chiropractors' lives. And so therefore, if it's not on the menu, anything beyond that would seem to be, whoa, this is not a good thing. So ignorance, they just don't simply know. Now, the prejudice, when we get to that, is we basically already said the idea that, oh, anything that's associated with he who shall not be named and his forbidden box of secrets, it's all hoodoo voodoo. And people oftentimes then they fall prey to the, not the historical fallacy, but a recency fallacy. The belief that because something is old, it's antiquated. The belief that the newer is actually better. So, okay, hey, we have all of this new stuff. Oh, that stuff that they were doing back in the 30s, the 40s, and the 50s. No. We do it so much better these days. Well, yes, we probably do know. We know an awful lot more about the neurophysiology, the mechanisms, and all of this sort of stuff. But alas, I would go a very long way. If you were to take a chiropractor from that era and put them against the best of the best of the best that we have today, I'd be willing to bet that that chiropractor of the past, they would be dancing around in circles. They know things that we've forgotten. And our best hope then, not simply is to look forward, but we have to look into the past. Lastly, then the superstition. So as Dr. Brooks had said it, believing something that simply put isn't true. So why would I need to focus on just atlas axis? Because you can have so many different subluxations. I adjust atlas and axis. So what could those guys possibly be doing that would really be any different or by any way, superior than anything that I would be doing? They're missing oh so terribly much. I would make the case that the more that I've specialized in the area, and I'm sure that you would agree too, is that the upper cervical spine represents a microcosm of understanding the entire body. The better you understand the biomechanics, the neurology, and the far-reaching effects of a problem in the upper neck, the reality is the better that you understand the entire system. So I do not call myself an HIO or an upper cervical exclusive practitioner by any stretch of the imagination. I call myself upper cervical specific. What that means is it means that I believe that this area is predominant. If this area ain't right, none of the rest of it ever can be. But can there be independent issues that happen in the spine? Absolutely, yes. And if so, do they need to be adjusted? Very much so. Key then is knowing where are they, which way have they gone, and perhaps what different move or technique might be best suited for addressing those independent cases. You see, we've got over 40 different mainstream chiropractic techniques, here still in 2001. And so if any one of them, again, had all of the answers, we'd all be doing it with 100% success. Well, until somebody has that, we all still have a lot to learn from each other. And so there may be times when in reality, a person needs a kind of chiropractor, a kind of adjustment that I am not expert in. So it behooves me, okay, I got to get them to them. But vice versa, it also has to go the other way. We as chiropractors have to get over that ego and belief that if this person isn't getting right, nothing can get them right. No, chiropractic didn't fail them. It could have just been our own skills, or they need something slightly different. So refer them to another chiropractor, even somebody who does a different technique. Why? Because they might have something special that you don't, whether that's focusing on the neck, focusing on their low back, focusing on their little toe. If it gets the outcome, I'm all for it. Now, of course, limitations of matter. So do we also have to refer outside of the field? Can there be other things beside chiropractic that go on? In my opinion, yes. And so therefore we need to get them to the right person. So we need a way of dispelling the dogmas, the false beliefs, the superstitions, all of this sort of stuff that, permeates, again, not just chiropractic, but I think it's part of the human condition, ultimately, so that we can move forward in spite of ourselves, so that we might be able to not just grow as an individual, grow as a profession, but ultimately have a greater impact on humanity. Long answer to a short question.
No, well put. It's good to hear. You're presenting your own programs, and that's evident. You've taught in several different school contexts, at Palmer, I believe, and in Australia. You presented in New Zealand?
I have not officially at the school, no. But I have given courses. I have given my own, but I've given the Blair seminars over in New Zealand.
So what's your vision of a chiropractic institution in terms of a good basis for an educational system, or what's missing from our institutions at the moment, in your opinion?
The school?
Would you base it in a okay? Would you base it? I love that. Would you base it in a university? Would you do a private college, or is that like what? Yeah, give us an idea of the Hannah Institute for Chiropractic missionaries.
Okay. Well, I have these different types of conversations with my dad very frequently, being in education.
And we'll drag him on here as well.
Yeah, make sure that they're getting this, make sure that they're getting that, and all of that sort of stuff.
And he was a great, is a great.
And just as a bit of background then for all of your viewers out there. So I would have come more from the other side of chiropractic, the one that was very all about the diagnosis. Subluxation was a dirty word. And this was not because of my dad. This is just the way that my brain works, as you probably gathered, very analytical. So, if you can't back up what you're saying, it's all crap. And so I went through school very much with the medically orientated mindset. And then, as you do, you have a few experiences and you realize, okay, wow, I was quite far off base. Fortunately, I knew where to go back and get the information. And so, as is the way I do things, I dive into it, dissect it from every angle so that I understand all of these. So I've had plenty of time to think about that. So as far as, what would a Hannah Institute look like? One of the big bits that I would certainly want to emphasize would be philosophy. Now, I had 6 philosophies and I thought that they were all garbage going through them. So let me change the language ever so slightly. I'm not going to use the word philosophy. I'm going to talk about principles. I'm going to talk about principles about this is the way that the human body actually works. These are the things that we have observed as human beings, as doctors through millennia. And so in reality, what we are doing as chiropractors is we're not looking to control, we're not looking to manipulate, Because in reality, we can't do that. We need to work with the forces that animate and give the function to the human body, basically keeping us alive, well, and healthy. So what are the rules of the game? And laying that right out there first and foremost. So having emphasis on principles and then showing then, well, what is the role of chiropractic as a separate institute? What is the place and time of medicine? What is the place and time of surgery? What is the place and time of physiotherapy, massage therapy, acupuncture? And of course, there's going to be gray zones, but if we can at least define, and in reality, everybody has different definitions, but you're talking about when I rule the world. So that's okay. Being able to clearly define, this is what the origin of that profession was. This is what it stands for. And this is really the bread and butter, what it is all about. So to say, this is the principle of chiropractic, not the chiropractic principle of chiropractic, or principles. What are they? And then let's take that and apply that then into everything that we are doing. So of course we need to know our neurology, our neuroanatomy. I'm very much of the opinion we also need to know our physiology and our pathophysiology, not for the purpose of making the diagnosis, because in reality, diagnosis, what's in a name? But if we understand and can get the young docs to understand, okay, a diagnosis is an effect. And an effect, you can get there a number of different ways. It could be because this is actually normal physiology from crappy lifestyle, or it could be because something has gone wrong. And is it possible then, how did this person get there? Is it possible and probable that it would be coming from a condition of the spine? Something that we should be able to quantify, should be able to measure. And then how do we do that? Well, we need to understand biomechanics, and we need to understand how these different conditions of the spine can be affecting the neurophysiology in this way. So therefore, we have a rational, idea. We're not just pushing bones for the sake of pushing bones so the person feels better. No, if we do this, do we have a reasonable expectation of positive benefit? So we do that, then we teach them the moves as far as how that needs to be done. And pick the ones that are actually going to be effective. Pick the best of the best of the best moves among the different techniques. And in reality, be open and say, okay, we don't have it all completely figured out. And we do hope that you guys will continue to grow, learn, and evolve. But these are the different options that do exist within chiropractic. Some prefer to specialize with kids. Other people, that's the worst thing they could ever do. They would much rather, just work in pain clinics. There's a time and a place for it. And others would say, okay, no, I need to work on the family practice. But we also then need to be absolutely clear, what are our reasonable outcome measures? See, because just because a person is necessarily feeling better doesn't mean that we actually did anything to help them in the long term. And conversely, just because they're not feeling any different didn't mean that we actually didn't do anything that actually did help them. Yeah. So we need to marry and reconcile these different kinds of ideas ultimately so that the young chiropractors go out and most importantly, they leave school not being confused, not knowing, okay, well, I'm very good at making a diagnosis, but what do I adjust? And how do I adjust? And how do I know when I should? And how do I know when I've been successful? And what's an appropriate, standard of care? And again, I'm not talking about technique here. And I'm not even talking about everybody agreeing and getting along. I'm just talking about consensus, the idea that it's like, okay, I see your viewpoint and you have thought about this. You've put in some real thought as far as this is why you are recommending or doing what you're doing. I may not agree with it, but I see your point of view. Because from there, we can have a better dialogue. And with the better dialogue, then again, it gives us that opportunity to grow, or again, as BJ would describe, conflicts clarify.
Wonderful. Nice rundown there. Okay, let's jump a bit. What are your favorite, say, conditions that people come in with that you're interested in? Do you have a little pet specialization? Do you have a little focus on something that you really enjoy attracting to your office?
You do realize that you basically just asked the oncologist, so what's your favorite type of cancer?
Well, there may be, yeah, I mean, there are, you mentioned specialties in chiropractic, in medicine and chiropractic, and specialties, I think, exist primarily maybe for two reasons. One, you get a lot of money from something, or two, you have a passion for it. So,
Yeah, I need to
yeah,
work on
I
that
might
first
like,
one.
liver cancer over thyroid.
I need to work on that first one a little bit more, if I am being honest. Typically, because I'm a problem solver. And so I do enjoy a bit of the challenging cases. I like being able to have the opportunity to work with the people with the chronic and the challenging things. But I also don't like the ones that are so challenging that they baffle me. And I do get them also. So I typically see the people who have been to XYZ, and these are very frequently the vertigos, the dizziness, the blank neuralgias, so the suboccipital neuralgias, the fibromyalgias, the trigeminal neuralgias. Some days I do say it's like, God, what I would give for some of the quote, the easy kind of stuff, the easy stuff. So those are most of, who I see. Now, who are the ones that I love? I love the ones where all I have to do is adjust them and problem solved.
Sure.
And better yet, when I only have to adjust them the once or even the couple of times, those are the ones who I love the most. Now, do I have all of the control over that? Absolutely not. Because the reality is that a huge percent of the people who I see in my practice, guess what? I'm not solving them on my own. I oftentimes have to make referrals to dentists, nutritionists, optometrists, other chiropractors for another different the conditions. In brief, because even though, this is my area of focus, okay, this is the piece of the puzzle that I can help solve. Because I've seen enough of these cases, and again, not enough of them, it's helped me to be able to see things more. So oftentimes these people have gone the entire, the medical route and all that sort of stuff. Nobody has any answers. But I look at them for even all of 5 minutes and I can see that they've got A, B, and C that nobody has actually caught up to that point. And so I will oftentimes use the example for these people of, okay, the nature of what you have in reality is if it was simple, somebody would have been able to figure it out by now. And you are like a combination lock. Combination lock, you need all the digits, and guess what? You need them in the right order. Because you can do the first two and you get frustrated saying, I'm not getting anywhere with this. And you do the last one and it looks like magic. And you say, well, why didn't I just do that first? Well, if you're a combination lock, if you did just that one first, it wouldn't have worked. You would have needed the other pieces. So who are some of the people and the ones who I enjoy helping the most? They're the people, of course, where if all they need is an adjustment, I love that. Or they are the people where I can get them to the right person and nevertheless make that difference because of my own experiences, what I've learned, knowing, okay, I'm not going to be able to fix or help everybody, but if I can get them to the right person, then they can still get better.
What's your feeling on a resurgence? Like you mentioned, let's go back to not forget the past and let's not focus on novel things that seem new and fantastic. Do you think that you come across a few students, what's their interest level? What's their curiosity? What's their spizzerinctum at the moment, do you think?
That varies. Yeah, that one's it's an extraordinarily broad question. It varies. Now, I am not the outgoing, bubbly personality. You've probably gathered that, and all of your viewers have probably realized that it's like, wow, this guy seems he's quite knowledgeable, but he also seems like he's a bit of a jerk. But in the end of the day, I do perceive myself as being a nice guy, and do genuinely want to help people and do the very best that we can, and actually can be pleasant, every once in a while. But nevertheless, I'm not always in the forefront of people's minds, especially with students. And I was the same way. I never went to any outside events. I thought everything that I can get, I will get going to class.
Right.
And all of this spiz, we don't need it. Now, Spiz is important, but I also don't like the stuff that's all spiz, no substance. And so I personally am very much of the persuasion, whatever it is, there's a time for spiz, but it has to be backed up by substance at the same time. But in the same breath, I do understand the challenges of students where they're so busy having to memorize things that they don't have the opportunity to actually learn anything. And so what are they going to do? Are they going to, come to or check in on a lecture that I might be giving where I'm trying to give them, little pieces of gold, like this is really going to help you out? Or do you need to study for that test that's coming up later this week? Well, they're going to say we need to study for this test, because they're right. They do need to pass that, because otherwise this is for nothing but, losing the forest through the trees. And so I see a lot of that. I see an awful lot of that that exists in the in the young dogs.
When we were at Palmer, a lot of people came on campus, if you recall.
Oh yeah,
That's how I learned Atlas orthogonal.
Mm-hmm.
And we were genuinely curious about what else was out there. So I guess, do you think the students today kind of are craving something? Are they interested in reaching out? I want to learn a bit more about this. I can't say I get many students who are curious. However, do you find that they're just sticking to the curriculum? And
little bits.
I think we were lucky at Palmer to have so many people come on campus. And
correct.
It seems like currently in Australia, not many people leave their boot marks in the hallways, do they? Technique,
typically,
kind of people?
No, typically no. And again, at Palmer, there were most people in my class, I would say, like you, they took advantage of those opportunities.
Yeah, it's what the heck, it's there,
Exactly, but I didn't. I just
You
focused
didn't?
on everything else in front. No, I didn't. But that's part of the reason why I care about this so much now, is because I consider myself fortunate that nevertheless, I ended up, whether by design or default or accident, I ended up doing the exact thing that I could be the very most passionate about, in part because when I did realize the disconnect, I knew where to go back to get it.
Yes.
It was like, okay, I'll do that later. Yeah. So I knew where to go back to find it. And so many of the young ones, unfortunately, I don't think that they do. They do know where to find it.
That surprises me a little bit. Do you think you had a little bit of dad's kind of drip feeding that
we never really had those in-depth, we never had those in-depth kind of conversations?
No, interesting.
To tell you the
truth.
Osmosis. No, it was mostly the questions that I would be asking him. They were mostly technical questions. They weren't really about what drives you. How do you do better in this? What about, how do you communicate, all of these different kinds of things? So really about principle, passion, or any of that. We never really had those kinds of conversations. And it's not to say that, he didn't, give and he didn't provide there. It typically didn't come up because my mind was okay. I would always be asking him about other things. And so the same thing, I think that a lot of the young ones now, they want to know, because again, it's all they know. They want to know what's your research paper about this, what's your thesis. They want to know what all of the brand new kinds of stuff is. And the very idea of principle is foreign to them. So foreign that they don't even know the question to ask. They know that something's missing, which is why you do have the advent of new schools that are and have been attempting to offer that missing something. Again, what would I have to say? It's principle that's missing. It's not that we are solely the body technician so that we are treating pain. We're not treating pain. We're treating a condition of the spine. Well, okay, how does that manifest? All right, well, this is why we need to know this. We need to know this. But how is this any different from a physiotherapist? And should we be doing rehab? And what does this paper say? And what does this paper say? And what does this paper say? And a good chunk of the problem is because they're told, okay, you're looking for linear relationships. Well, you and I know that the body is not a linear process. And we don't have the control to dictate things. Now, if you're trying to manipulate the outcome, yeah, that's fine. You can do that, but you can't trick the body, push come to shove. So if we're going to be working with through the principles of the way that the body actually works, we realize that there has to come a certain point where we are willing to let go of control. And the problem is that is not the way that scientific papers are operated. So that's scary, because what it means is that for these students, they have to let go of what they believe to be true so that they can actually step into something and come to learn it, or if you would, the difference between knowledge and wisdom.
In the next few minutes.
Or they very quickly get beat up in the course of their early days of practice. And either A, they get lucky and have a good mentor to help them out. B, they have a bad mentor, and then they fall into the masses, cracking spines, changing lives, happy with it. But are you really, reaching the peak? And you could be making a whole bunch of money, having a great lifestyle, and you still can be. You can be helping a lot of people, but is there still a bit of something missing? Could you be doing better? Or they quit.
In closing, what would be the unlimited cash of the Hannah Foundation? What research design would you implement? What research project would you begin tomorrow if I gave you 10 million?
10 million ain't going very far.
100.
Still probably not going very far.
Geez.
Nevertheless, you said unlimited.
Let's make it US dollars.
Then it's going even, you're still talking fiat. It's all too low.
I'll give you 25,000 Bitcoin.
25,000 Bitcoin.
You know what I mean?
I'd cash that out. That'd be a good one. Right?
Hey, let's not even talk money. What would be Jeffrey Hannah's pet research project tomorrow?
This is a tricky one, because even though I do very much, I value research, I'm also not the person to be doing it, in part because I can appreciate that in research, you have to control your variables. Absolutely. It's otherwise, how do you, demonstrate any degree of validity? But from what I have seen, just by peeking even that little bit behind the curtain, you have to go all the way back to test premises 0. That is the most boring thing in the world. So what would that, it would be almost, you would have to go point to demonstrate, does the spine fixate? Something like yes or no, or something like that. And then you need to back it up and all of this sort of stuff.
That's a bit
Nevertheless,
like the,
what would let's also exactly. Now let's presume then that a certain amount of legwork has been done, and let's also presume alien technology. Okay. What would it look like? It would look like where you would devise either an instrument or a series of protocols, and you put them through an algorithm that ultimately determine, is there mechanical subluxation occurring at the spine, and at what level or levels, and what direction, degree, and orientation. So you can use combinations of imaging, you can use the pressure devices, different things like, let's say that the technology existed. And you also have ways then of measuring the neurophysiology. So let's even say like the research with the EEGs, looking at, okay, does the brain light up? And so what I'm basically saying is, I'm saying that you have the ability to come to consensus that this is where and how you measure the components of the mechanical aspect of subluxation. And you can also measure that the neurophysiology is not correct. Then take the techniques and fight to the death. Pick the best of the best of the best in each and every one of them. It ain't going to be me, but take the best of the best of the best, and then post-check them on, did they correct that mechanical aspect? Yes or no? In other words, is the joint moving better? Yes or no? What % improvement? Yes or no? And maybe not even just after one adjustment, but let's assess this over a long period of time.
Mm,
You know, following the protocol, how many adjustments were actually necessary to get a desirable outcome?
mm.
Was it one, or did you have to do 24? Did you have to be seen once a week, or did you have to come in 3 times a week? Did you come in once a month?
So it sounds like we
But
need
let's compare it then to the neurology. So we just talked about the mechanical, but then also let's look at that brain. Did that brain light up? Did it change? And in what ways and in what capacities? Again, I find it fascinating, if you would, that the brain has the ability to process oh so many different senses. And yet somehow, even when we're considering the cervical spine, with is laden with sensors for pain, pressure, and proprioception, that somehow or another, you make a mechanical impulse into the neck, but it brain knows only to pay attention to the pain one, that there's no influence on either the pressure or the proprioception. That doesn't make sense. Now, does it? So what's the dynamic? What's the impact? And can it be that the adjustment is impacting different areas of neurophysiology in different nonlinear ways so that we understand what is both possible, but then also probable when we do these, and which method is best suited for dealing with the different conditions? So that in reality, you said unlimited resources. So that would be it, unlimited resources. And in reality, you're probably looking at the better part of 100 years plus of research right there. That'll keep us busy. But I think that the big thing that I may not know what the answer is, but I do know what we have to stop doing in chiropractic research. Stop focusing on diagnoses. And the reason for that, even the concept of mechanical low back pain, you can have low back pain because you're subluxated, and you can have low back pain because you're too fat.
Mm-hmm.
You can have the same effect, but how you got there was 2 different ways. And I get it. You go through exclusion criteria to try to minimize the number of variables, but in reality, you can't do that. See, any more than you can say that an adjustment direct of the low back fixes low back pain. It's not linear. It doesn't work that way, because it could be that it changes middle back pain, or it could be that it improves your balance, or it can improve your hip. So it's a non-linear response. So what we need to better understand is is it possible first that the adjustment of the spine can improve these, but then also what is the probability given also the other possibilities of what it is. So that way we know, and we have better ways of diagnosing, okay, if a person is experiencing any symptom you want to think of, is it because of lifestyle? Is it because of an extraneous variable? Or in reality, is it, no matter what or how exotic that symptom might be, is it in this particular case because the spine actually is what needs the adjustment? And therefore, that would actually be the missing piece that they need. But we've got to get away from focusing on the symptomatic outcome. It's important, but we can't control that as the outcome every single time. There are too many variables, and they're unknown variables.
Well put. We're going to draw it to a close there soon. So what you've said is we need to rehash the electroencephaloneuromentypograph.
Well, from what I understand, in many ways, it already had been, because I understand that it's being a precursor to the EEGs, right, but also the surface EMGs. Yeah. In other words, sensitive but not specific. But nevertheless, if we could identify and say, okay, well, this is the parameter, this is the measure of normal brain activity, normal spine activity, normal neurophysiology, and then we say, okay, well, before an adjustment, yeah, this thing's pretty messed up. Post-adjustment, hey, wow, that got better. You didn't ask them about, did you fix their pain? You measured, you improved their neurophysiology. So, okay, long answer to a short question again, or maybe a long answer to a question you didn't ask, or the other way around. We need to focus on changing neurophysiology.
Sounds good. On that note,
and
we'll adjourn until the next time. Jeffrey, you're a genius, and I think we're going to continue this discussion. Thank you for coming on the show.
Yep, no problem. I don't know about genius. Mad, certainly. And now, again, all of your
viewers know. There's a fine line.
Very fine line. We like to dance that line. We like to see, it's like, where is its cliff?
Don't worry, I know. All right, Jeff. Good night, and I'll talk to you soon.
All right. Thanks, Joe. Thank you for having me.
Bye-bye.